Hi everybody. So today's presentation is going to be on research versus quality improvement, or QI, in healthcare and understanding the key differences. And my name is Dr. Norma Hilsman. So I'd like to help you to understand that when attempting to understand the important differences between research and QI, you need to consider some key points. One would be purpose. The second would be scope. The third would be methodology, the fourth is outcomes, and the fifth is ethical review. Research aims to generate new knowledge or validate existing knowledge, and it seeks to answer specific research questions or test hypotheses. Quality improvement focuses more on improving the processes and outcomes or systems within a specific organization or unit, and it aims to solve more practical problems rather than generating a new knowledge. The scope with research often applies to large populations and seeks to generalize the results, whereas quality improvement, or QI, focuses on local populations or specific clinical settings, for example, maybe a specific unit or a hospital, in addressing issues that are relevant or very particular to that environment and are not necessarily generalizable. If they are generalizable, or you want to generalize your findings and you see great value or worth, that's when a quality improvement crosses over into the research realm and needs to then go through an ethics review board. In methodology, so research employs rigorous and standardized methods like randomized controlled trials, or RCTs, cohort studies, or surveys. They're highly controlled research designs to ensure reliability and validity. Now, surveys aren't necessarily, for example, in a quality improvement, you may do some surveys, but you're not to gather information that's going to be relevant to a larger population, for example, maybe across Canada. Just to put that out there. With quality improvement, it's an iterative or successive repetition process. It's flexible data collection tied to the improvement effort. So data collection is practical and again tied to the improvement effort. Now here's some example of some QI models, just so that you're aware that there are lots of options, and just like in research, there's many tools and frameworks that you can use. QI models are more specific to QI projects, and it creates a framework for your project to ensure that there are steps that you don't forget in the process. It helps you to kind of take this well thought out plan and apply it in relevance to your project. So for example, QI uses methods like Plan, Do, Study, Act, PDSA cycles, or Lean, or Six Sigma, while other frameworks like Lean or Six Sigma are frequently applied in healthcare. Just so that you're aware, they originated in industries outside of healthcare. So numbers 1 to 6 were actually originated in healthcare, and then numbers 1 to 9 on the right hand side were actually later adapted for healthcare use. So just to put them out there if you're looking for one. Some outcomes. Research aims to produce evidence that contributes to the body of knowledge and often published in peer-reviewed journals, whereas quality improvement aims to produce immediate actionable improvements in specific systems or processes and results often in shared or internal reports. So again, a way to think of it is research produces findings that contribute to a broader understanding and can influence policies and guidelines globally, whereas quality improvement leads to tangible, direct improvements in local practice. So like enhancing efficiency and patient outcomes. With ethics review, note that research requires approval from an IRB in the United States or an REB in Canada, as it may involve risk to participants, whereas a quality improvement may not always require ethical approval, though some projects, again, may need ethical oversight if there's potential risk, particularly when patient safety or patient anonymity may be a concern. So for example, I've given you a research example would be a study evaluating the efficacy of a new medication for reducing hospital readmissions for heart failure patients. That could be anywhere. Whereas a quality improvement example would be a project to reduce medication errors in a specific hospital by implementing a new electronic prescribing system unique to that facility. So I've given some examples, 4 examples in healthcare and 4 examples in education. Hopefully some of these might help you to kind of figure out where your project might fall. Reducing patient falls. So research uses randomized controlled trials to evaluate a fall prevention protocol, whereas the quality improvement of reducing patient falls might be to implement a plan, do, study, and act cycle to test hourly rounding in a unit. Pain management, well, research might be to investigate mindfulness training on a chronic pain management, and quality improvement would be to ensure that postoperative pain assessments are being completed at a specific area. Maybe it's improving hand hygiene compliance. So a research approach might be to examine factors influencing hand hygiene compliance in general. Whereas quality improvement is trial interventions like signage and sanitizer stations at your hospital or facility. Nurse burnout and retention, that's always a good one. Research would be to explore the relationship between nurse burnout and staffing ratios, whereas the quality improvement would be to conduct a project to improve staff satisfaction and retention rates. Nursing education, so we'll look at clinical documentation. So research would be a study to evaluate the effect of a new electronic health record or EHR training program on nursing students' accuracy and efficiency in clinical documentation. Whereas a quality improvement would be to implement a quality improvement project to address gaps in nursing students' clinical documentation skills by providing targeted electronic health record training and monitoring improvements over time, maybe with as part of a clinical evaluation for your facility. Another one might be simulation training. So a research would be to look at or investigate the impact of high fidelity simulation training on nursing students' clinical skills and confidence by comparing it to traditional classroom-based learning. A quality improvement would be using a QI approach to integrate and optimize the use of simulation training in the nursing curriculum at your particular facility, measuring student outcomes and continuously improving the simulation experiences based on performance data. It's making your program better. So some key differences and overlap is remembering that research is designed to contribute generalizable knowledge for adoption by other institutions, and quality improvement is designed to improve specific outcomes in a particular setting. Insights may not always apply elsewhere. So if you are wanting to do a bit of a group activity, something to consider would be to discuss or identify if your project is either a QI or a research project. And if so, which would you then have to consider, an IRECI or a review ethic board? And then how does differentiating these play out when planning your project, and are there aspects you're having challenges or uncertainties about, so to consider in your project? So a quick conclusion is to remember that the purpose, so research is generalizable, QI is specific. Your scope addresses large generalized populations. QI is more local populations or specific clinical settings. Methodology uses randomized controlled trials and surveys that are specific to a very rigorous standardized method. And QI employs that iterative, flexible, successive, repetitive method like PDSA cycles and Lean. And Lean, just a little point, is Lean is often used more from large organization, reorganization or changes, I guess. Outcomes for research, it's often published in peer-reviewed journals, and quality improvement aims for immediate or actionable, and it's reported, the improvements are reported internally. And then your ethics review, of course, research requires an REB, and QI may not always need an REB approval, but it may need an ethical oversight if risk is present. So thank you very